I love the smiles that get uncovered when we take the masks off.
It's like, oh, happy
Hey,
day.
yeah.
Oh, goodness, we're back again.
We're back again. Here we
love it.
are. Yes.
Well, hello, everyone.
Hi, everyone. Yeah. Greetings from Colorado Springs. It's a beautiful, crisp morning here. I know parts of our country have really been under a deep freeze, and our thoughts go out to everybody in those places, especially Texas, who have really been suffering right now.
Absolutely.
Yeah.
You know, it almost makes me feel a little guilty looking back and seeing this beautiful blue sky. But it doesn't go without thinking about those of you who are really challenged by the weather that we have today. But on the other hand, if you can use the outdoors to take a deep breath and just
Yes.
woosah.
Woosah. Yeah.
It really does help in many ways than not, you know, including when you're fatigued.
And that is going to be our topic today.
Fantastic.
Compassion fatigue. And before we get started, just another introduction. I'm Dr. Sheri Gibson.
And I'm Dr. Regina Lewis.
And we are so excited again to bring you another wonderful discussion around an important topic. And want to thank the Connecticut State Long-Term Care Ombudsman who have supported us in this podcast through funding with the CARES Act.
Yes.
This has been great, and I'm going to be sad to see it go away, actually.
Oh, I know.
We're almost to the end.
Well, you know what? We still have a couple of...
We have a couple more still.
To go. Yes.
So... compassion fatigue, such an interesting concept that's been around since the 1990s. Was first that term was first researched and developed by Joynson and colleagues back in early 1990s. And really, this idea of compassion fatigue was to understand what happened, at least back then, what happens particularly in nurses who provide ongoing care, very intimate care to patients, and how do they get to a point, what is the pathway for developing a fatigue that is different from burnout? And so there's a couple of key concepts that's been differentiated in the literature. One is that we have to know the difference between empathy and sympathy, which those two terms can be used interchangeably, but they are very different.
Yes, they are.
They are.
Yes, they are.
So for our listeners who may not know the difference, sympathy is basically this, I understand, or I see what you're going through.
Right.
I feel badly for what you're going through. But empathy takes it another step, which is, I see what you're going through, and because you're sharing it with me, I can feel what you're going through.
Absolutely. It makes that connection.
Makes the connection.
Wherein when you're talking about sympathy, there's still that separation that's in there.
Yep, that separation. And empathy is feeling that the suffering with the person. Now, compassion takes it even another step further. So it is, I see you, I hear you, I understand, and I feel that. Now I have an authentic desire to want to help you and to relieve the suffering. So it really takes an action to be compassionate.
Wow. I love the way that you said that. And when you put compassion, fatigue together, that actually helps people to feel a little bit better, because it's like, I'm not supposed to feel this way. Now I feel really guilty because I should have this compassion. But when you understand it, as I'm sure you're going to go into it even further, that, you know, we can get tired.
Right.
Yeah.
Yeah, we can feel fatigued in that. You know, especially people who work in the helping professions. Well, and we could even say informal caregivers.
Sure.
You're an informal caregiver to your own mother.
Yes.
And there's many people out there who are unpaid informal caregivers.
Absolutely.
Absolutely. And then you have the formal paid caregivers who are, you know, anyone in the helping professions. And there's kind of two things that happen. One, we come into our work or into our caregiving experience with already developed empathy. We have that ability to empathize and to connect with people, but it's a gift and a curse. Because the gift is that we can easily connect with people if we're highly empathic. We can easily build rapport with people. The curse of that is that if we're not careful, we can lose ourselves in it.
Yes.
And some of the challenge is allowing people to also be empowered in their own treatment, their own care, while supporting them. I think a lot about the great healers of our time that we know, like Mother Teresa and Gandhi.
Yes.
And these are people who were highly compassionate, highly empathic people, but they didn't lose themselves in it.
That was the key.
Right?
That was the key.
You never, or we didn't know anyway, if they were suffering from fatigue. And I think that what we know in the literature is that the antidote to compassion fatigue, to intervening or preventing it, is resilience.
Yes.
Building resiliency. And I think that that's probably what Gandhi and Mother Teresa must have had as part of their character, their internal factor that prevented that from developing.
Absolutely. I believe that when we even look at the nurses and doctors and healthcare providers or who are front line with what's going on today with COVID,
Right.
many of them have had to have the resiliency to get up and do it again the next day.
Yeah.
Because every day is something new.
Right.
And it could be traumatic. It could, it could weigh on themselves. They have to take care of themselves. And so really understanding this, when you talked about building resiliency, I believe that is strong. It's key.
It is very key. The ways that we do that is, it first starts with self-awareness. Being aware that we're struggling, being aware that we're having difficulty. I have a very good friend and colleague of mine who talks about her resentimeter. She uses it, and that really applies to me too. When I start feeling resentful about my work, about relationships, about any number of factors in my life, then I know that that's when I need to dial it back, or that's when I need to take stock of what's on my plate.
Sure.
And I need to start taking care of myself.
Right.
But that's really challenging for some people, especially caregivers, who feel that it is my duty, my obligation to do this.
Yes.
And to take self-care, to turn that care inward, is so foreign, and I feel so guilty doing it, and all my energy should be on the other.
Absolutely. And when you mentioned that, it just made me think about the cultural aspect of this.
Exactly.
I talk about cultural responsiveness and really understanding it at another level, which is the cultural aspect. And so, there are many people of color who it is just by nature that they take care of their parents. And it almost feels like an obligation. And you start referencing that to, say, the Bible, what you're supposed to do, and honor thy mother and thy father, and your days will be longer, and what it is expected of you, especially if you are one of the children or the child that already has developed that empathy.
Right.
Then there's this expectation. You're tired, you're frustrated, you go through that resentment, but then you feel guilty, so you continue to let it come. And so when you said take care of yourself, what does that really mean? Because some people would think that would be selfish.
Right.
So talk to us a little bit more about that.
Yeah. What does it mean to take care of ourselves? Well, as we have mentioned throughout all these topics,
yes,
it's very individualized. What I do to take care of myself is going to be very different probably from what you do, or what the next person does, and so on.
Right.
And so I think one of the things that we have to be aware of is there's a couple of areas around self-awareness that we have to build our skills. I want to go back to like superheroes. So you know that most superheroes, they have when the thing happens to them that brings them to their knees, they fall quickly.
Yes.
Right?
Yes.
They go down. They go down real quick.
Yeah.
Well, what we need to do is we need to build up these kind of resilient skills
Right.
so that we don't fall to our knees quickly.
Right.
Because with compassion fatigue, which is very different from burnout, what happens in compassion fatigue is that you see the person just walk out of a job, for example.
Right.
They totally, we call it flip the table.
Yeah.
I'm
Gone.
done, I'm over. And they have really limited awareness about what caused it to happen.
Wow.
With burnout, it's a gradual eroding. The person feels a lack of satisfaction in their work. They feel an achievement void in their work. It's almost like a slow burning depression that comes over a person. And burnout is the type of thing that does an HR department right? Or other professions. But when you're
Right.
in the helping profession,
Oh, yeah.
that's where it comes on us very quickly. And there's an existential component to compassion fatigue, because what happens is that we are witnessing the suffering of somebody else.
Oh,
And
yes.
and as a compassionate person, we want to relieve the suffering or relieve the burden in order for that person to feel better.
Sure.
Well, when we do that over and over again, and we don't detach ourselves from the suffering, that's where compassion fatigue strikes us down. And oftentimes we don't have a connection to the real cause of that.
Right.
So some of the things that we need to do is, one, know how to detach ourselves.
Right.
And detachment can be an act of self-care. You know, in current contemporary times, a lot of people are working from home.
Right.
If you're a caregiver in the home, you know that you're rarely leaving that situation. And for caregivers who are also working in the home with a person that they're caring for in the home,
Yes.
you're not, and whether that's a child or
Right.
an ill person or an older parent, any number of those things, you never get a break.
Right.
So part of that self-care is maybe finding ways to detach
Right.
without removing your care and concern. But by detachment, it can be very small things like taking a walk around the block, giving yourself a moment of break, or maybe it's actually taking a day off from it.
Sure.
Delegating,
Right.
knowing who else could step in and
Right.
help me. That's another thing that's really hard for caregivers because we love there's something about we feel that we need to control the situation.
Right.
And nobody can do it as good as we can do it.
Right.
I come from a long line of women whose mantra is, if you want it done right, you do it yourself.
Oh my gosh.
And that bites us.
Yes.
Because if I
Yes.
don't give up that control, if I don't delegate,
Right.
one, I don't know the strengths of the other people in my life and what they can do for
Absolutely.
me. And two, I never get that break, and then I will end up hurting myself in the long run.
Absolutely. You know, when you talk about that, that's a mind shift. And sometimes it's not easy. So let's talk about people who come from poverty versus those who are from middle class. So
Right.
when I look at the work of, from Bridges Out of Poverty and just really seeing what they talk about, what the core is in poverty, it's about relationships. Everything centers around relationships. And so you're there, you're with the caregiver, and you fall on the sword, so to speak. And so then that's where that compassion fatigue comes in. And it's a struggle
Right.
because you even start to see yourself on the other side and worried, I have to treat this person this way because I want somebody else to treat me this way. And so it continues to make a cycle whereby in middle class, it really talks about the core being about achievement, to be able to sustain and move forward.
Yeah.
And so what you're saying, that suggestion almost sounds to a person it has a poverty mindset, like achievement, like I have to move forward. and leave someone behind. I know
Yes.
that Dr. Ruby Payne talks about in order to achieve, you must leave a relationship at least for a time.
Mm-hmm.
But in this particular case, what you're saying is you don't have to leave the relationship, but what you do is you add to it to give you a break. Reach out,
Right.
delegate, bring in other relationships that will help you, because one thing is for sure, if you help yourself, then you can better help someone else.
Right.
Yeah.
That is such. Thank you for bringing that up. And as you're talking, I'm thinking about in terms of culture. You know, we can talk about individualistic cultures too, who emphasize the importance of autonomy.
That's right.
Autonomy in decision making, and even in healthcare and everything else. So I work, I am an autonomous individual. I make the decisions,
Right.
versus a collectivist culture where it's shared decision making,
Right.
where it's integrated decision making, and families are doing it together.
Exactly.
And I would imagine, I don't see why I wouldn't see it any other way, but in a collectivist culture, I would suspect that you would see lower rates of compassion fatigue because that is spread out amongst other family members, whereas in individualistic cultures,
Sure.
where we take it all on ourselves,
Yes.
and we shoulder that burden, we don't reach out. I mean, reaching out and asking for help can be a sign of weakness.
Right. Oh
Right?
my gosh.
Can
Yes.
be a sign, and there's a bit of martyrdom that comes in with that too.
Right.
So I'm thinking about kind of that shared decision making. If there are pieces of that we have to, those of us who are more individualistic, if we can expand that circle and know that that's not a sign of weakness, and also taking ourselves out of the picture sometimes.
Absolutely.
If I'm helping myself, we often don't think about this, but when I turn the care inward,
Right.
I'm actually giving better care to the other,
Right.
whether that's the family member, or if I'm working in a nursing community, or in any kind of healthcare setting. Even me as a psychologist,
Right.
it's an ethical standard for
Right.
me to meet in order to take care of myself so that I can better serve my clients.
Absolutely. When you talk about that sounds so foreign at some point for me. To stop for a moment and take care of me, it just seems strange. In many cultures, they used to come with large families. So there was many siblings that you could reach out and maybe even if you don't reach out for help, they start to see it, and everybody has a role in which they bring a part of themselves into.
Sure.
However, more and more families are coming up with one child. A single child. So like I am a parent that had one child, and I had to realize that this entire piece that you're talking about, reaching out and self-care, has to be implicitly taught. This is the reason why we're having this conversation now.
Absolutely.
And so for me, I have to set the example and model behavior so my son would know what to do. How does he take care of himself, and letting him see that it is okay.
Right.
As he's watching me
Yeah.
take care of my mother, when he gets to a point where he sees, okay, what do I do with my mother, right? Hopefully I have a plan so that he doesn't have to do that. However, if that ever became the case, he will now know that it is okay, because culturally, we oftentimes feel like it's not okay, it's our responsibility. And if we are really getting more and more fatigued, what we're supposed to do is fight through it and keep going, as opposed to pausing and taking care of ourselves.
That's right. That's right. And that brings me to maybe talking about what can people do
Yes.
tangibly
Yes.
to, one, you have to recognize when you're feeling a certain way.
Right.
That comes with the self-awareness. And really, we've talked about this, I think, kind of throughout some of these podcasts. Being aware of where you are in your body.
Right.
Notice if you're holding tension. Notice if you're kind of quick to temper. And that should be your red flag for taking care of yourself. pumping the brakes is what we call that. We are such an emotional, revved up kind of society.
Yes.
We thrive on chaos, to be exact. It's more exciting, right? And we don't teach emotional self-regulation.
Right.
We never learn how to do that. And really that's about taking a break, taking deep breaths. We've often talked about that. Using, coming back into your body and getting some movement, getting some fresh air. Those small things can be very helpful. The other piece of this is that we need to find meaning in suffering. Finding the meaning is very important, and that begs us all to look at those big existential questions about kind of good and bad and just and unjust, and what's a good death and a bad death, and all of those things that come up for us when we are confronted with the suffering of other people. So doing some self-reflection, holding up the mirror and making meaning of the suffering.
Absolutely.
That's a really important step that we have to do.
I also think that we all should have like a measuring stick to say, when can we say we've done a good job, that what we've done is okay? Because at the end of the day, if that loved one is no longer there with you, you need to be able to say, job well done. If we never feel like we're good enough, that there's I could have, should have, would have, then we will suffer long after that person is no longer in our care.
Right.
And so being able to say, you know what, I know that what I've done is a good job. And that is something that's not always easy to do. You have to decide when is enough to be able to do that. Another is to build community. Who will be a part of what I call your success entourage? Those individuals who are going to be there, who's got your back, who you can call on, and each person plays a different role. Maybe some of those individuals are just people that you just talk to.
Yep.
Just having a conversations. Others might come in for a couple of hours and let you just take a bath. You might not even leave your house. Could be somebody else who might pick up some groceries for you. I mean, to kind of take some of the burdens of everyday work and challenges off of you sometimes.
Right.
But you had also mentioned about an 800 number, and I would hope that you could mention that again, because that's just someone else or a group that could actually be part of that community.
Right. That's a wonderful reminder. I had mentioned in another podcast that there is a friendship line that is offered for older adults over the age of 60. And these are volunteers. The friendship line is offered by the Institute on Aging. And I'll leave the number, especially if you are a caregiver for somebody over the age of 60. And this would provide an outlet for them to have someone to talk to, because you may not be the best person for that person to communicate with.
Absolutely. And
it gets
gives
complicated.
You a break too.
It does give you a break. Right. Right. And let somebody who is objective, third party, also be able to be a part of what I would refer to as your virtual team.
Yes.
You called it the
success entourage.
Entourage. That's wonderful. That's great. So the number for the friendship line is 1-800-971-0016. Again, that's 1-800-971-0016. 24/7. They're available. It's a really wonderful resource.
That's fantastic.
It is.
That is fantastic. And, I think that there's so much media out there, and we talk about media sensationalism because sometimes there's information out there that can be overwhelming. But at the same time, that also could be part of this team,
right?
That can give a couple hours of a break, or maybe watching a story and you can actually see how someone in the story actually handles a similar situation. So it gives you ideas. Having conversations with others that say, I've done this before and this is what I did to have that self-care.
Absolutely.
Yeah.
There are so many resources available. Through the Alzheimer's Association, for example, they have caregiving classes. And that's a couple of other things I want to bring up for our listeners. You might want to, I definitely would recommend that if you're feeling this fatigue, and some of the symptoms are, we see it in work settings as well. So high absenteeism. We see people, not meeting deadlines, taking advantage of company time.
Sure.
And all of this then translates to the care that we give to the care recipient. So if you're starting to notice that this is something that you're struggling with, I do recommend that you seek professional help. You can talk to a mental health provider who will identify compassion fatigue and help you work through and build up some of those
Nice.
resiliency skills. You also want to check out compassionfatigue.org, a wonderful resource with lots of assessment tools, videos, other things that you can do to further your knowledge and education and awareness around this type of concept and what happens, this experience that happens to a lot of people. The other thing that I think has been helpful in this day of technology is there's so many apps that can be used. A couple of apps that I recommend are, and you and I've talked about this, Headspace.
Oh, absolutely.
Love it.
Oh, love it. Use it
How
all
do
the
you
time.
use it? How do you use it?
I listen to the stories. They read me stories at night before I go to sleep. So I use that. And then I listen to it each morning. It kind of gets me going because it will ask you, what is a goal that you have? And then it will remind and it will set up different ways of working with you on a daily basis to help you to reach those goals.
Wonderful.
So you could say self-care.
Yep.
And it would have it.
Wonderful.
Yeah.
So Headspace, there's one called the Daily OM, O-M. There's another one that I've used a lot, developed by some colleagues of mine at the VA and the National Center for PTSD, where I did my internship, part of my internship training at the VA Palo Alto, and it's called COVID Coach. And it's a free app, lots of wonderful things there. Deep breathing helps you with that cognitive restructuring that we talked about. How do we change the narrative of what we tell ourselves about any given situation? I also recommend that people keep a daily gratitude journal.
Oh, I love that.
Yeah.
That's a great idea.
It is. Every day, either before you get moving on your day or at the end of your day, write 3 things every day that you're grateful for.
Absolutely.
And what that does is it shifts our focus into the things that are working well in our lives. Oftentimes we spend a lot of time focusing on what's not working and what's really hard. And all of those things do exist. And we need to experience the other side of that so that there's a balance in our perception of suffering, that while this is happening, I'm also grateful for finding the little things that bring gratitude to my life. Because caregiving for many, many caregivers is one of the most rewarding things that we can do.
Absolutely.
To give back to the people who gave to us.
Oh, absolutely.
It's such a gift,
I
isn't it?
love that. And I do believe, if you come from a high touch culture, you like the touch. Another thing that you can do is get a weighted blanket. It just kind of falls and just when you're taking a moment for yourself and having that, it almost feels like it's something wrapping their arms around you. So I think that's another thing to do.
That's a wonderful resource.
Oh, yeah.
I need to get one of those.
Oh, absolutely.
I've seen them. I've always said that we should have thunder shirts for humans. Remember that's for the dogs?
Yes.
I'm like, I need a thunder shirt.
Oh, I love it. I love it. Wow. This has been fantastic.
It really has.
I even had some useful resources that I heard from you or really reminded me of things that I've forgotten. And so I've been able to take copious notes that I know that I'm going to use long after this podcast.
Great. That's wonderful.
Yeah.
And thank you for reminding us of how caregiving particularly is different across different cultures.
Yes.
And that the interpretation of care and the meaning of care is different. And so while I may be talking about self-care and the importance of that for collectivist culture,
Yes.
that might have a different meaning around self-care.
Absolutely.
And for people of color, that may look
Yes.
very differently too. So thank you for bringing that level of awareness to all of us, and so that we can be better stewards of that when we talk about self-care, when we talk with each other. One of the things that I want to just highlight before we say goodbye is that when you notice other people who are fatigued, and you know that they're in a high compassionate situation, whether
Yes.
formally or informally, oftentimes we don't respond to those people in a compassionate way. We're quite judgmental. Why don't they get it together?
Right.
Why aren't they on time? Why? So I want us to remember to ask, simply asking a person, are you okay? Do you need anything? I notice you're not acting the way I know you to act. What's going on with you? Because especially when we're working in healthcare settings, for example,
Mm-hmm.
I have to remind myself that everybody comes into that field, into that profession, with the same spirit of wanting to help, with a compassionate spirit.
Yes.
So when I see people acting in ways that indicate to me that that's not who they are, that that's not the work that I know them to do, it's a cue for me to become curious about that and see
Sure.
it through a lens of curiosity rather than through a lens of judgment.
I love that.
So I really want to remind us to embrace compassion towards one another if we're
Sure.
seeing that people are struggling.
That's fantastic. Thank you for those words of wisdom. I believe that it's going to help all of us.
I hope so.
All right.
Thank you, everybody. Thanks, Regina.
Thank you too,
You bet.
Sheri.
Okay.
Have a good evening.
Take care.